This is a what do people think? And this is going to be really fun and see how this goes. First victim, you get into the bus. You've already cleared the people, the minor injured, the walking wounded. They've cleared the scenario, the scene. You're now in the bus, and you come across your first victim. It's a male, 15-year-old, breathing normally, alert and coherent, but complaining about a sharp pain in his leg. Sharp leg in his pain. You check his capillary refill. It's 2 seconds. He can answer answer questions and perform simple tasks. But when you look at the leg, you see there's a large gash and it's bleeding heavily.
Okay.
What do you triage him as?
Bleeding heavily, I'm going to say immediate.
Why?
Bleed out.
Well, bleeding heavily, he could bleed out in a couple minutes.
Okay.
So I'd want to, jumping way ahead, I'd want to put some pressure on that bleeding to see if I could, try to stop the bleeding or slow it down or what have you.
Okay.
I
agree with that. I agree that you want to take action because this could be a potentially life-threatening injury, and you want to apply direct pressure, and you want to have someone else hold it. You don't want to stay there yourself holding this. But what else tells you that this person's immediate? Remember, 32 can do.
To me, he's delayed. Delayed.
Okay. Thanks, Sally. Ben, you said immediate. What tells you this person's immediate?
Well, I'm concerned even though he's normal breathing, perfusion is 2 seconds. Mentally, he seems like he's okay. He didn't walk out, so he's probably, for whatever reason, isn't walking. And again, the heavy bleeding I'm concerned about. Bleeding heavily. That's all relative, but when you say heavily, I assume there's, more than just getting a little pinprick or something. There's a lot of blood coming out, and he can bleed out.
And you can stop that with direct pressure, and you do, and the bleeding slows. Is this person immediate or delayed?
Delayed.
I would say delayed too.
Delayed.
And once I've got the bleeding under control, I guess we could downgrade him to delayed.
Okay. So remember, you want to follow the tests. The tests are what are going to tell you if this person is immediate or delayed, or green or black. Breathing normally, so less than 30 times a second. Alert and coherent, 2 second perfusion. 32 can do. The person is passing all the tests. Yes, that bleeding heavily is concerning. That is potentially a life-threatening injury, but he has not lost enough blood to impact his skin perfusion. If he lost enough blood, you would see that skin perfusion jump to 3, 4, 5 seconds as the body has tried to compensate for the blood loss. So you want to do something about it so the person doesn't go from delayed to immediate, but the person triages as delayed. Do something about the blood loss. Don't spend too much time on it. That's why you're grabbing people who are walking wounded. You can tell that person, hey, I need you to put direct pressure on this person's leg. Or you tell this kid, this 15-year-old, hey, I need you to push down real hard on your leg and to slow that bleeding. We're going to get back to it. That's the basics you can do. So, delayed. Victim number 2. Female, 16-year-old. Breathing rapidly. Alert, coherent, complains about stomach pain. She's visibly pale, and her skin perfusion is 5 seconds. But she can answer questions and perform simple tasks. No visible signs of bleeding.
Immediate.
How do you triage her?
Immediate.
Immediate looks like internal bleeding.
Okay.
Possible
Anybody say delayed?
No.
All right. Yes, she's immediate. She failed the skin perfusion test. 5 seconds. Full stop. But to get to that point, you checked her. She's breathing. Oh no, I'm sorry. Full stop was on the breathing rapidly. first thing you do, you see that she's breathing rapidly, she's immediate. You don't even need to go through the rest of those.
Right.
Victim number 3, female, 14. Not responsive, not breathing. You attempt to open her airway? Is that what everybody would do?
Yes.
Do you try and get her to
Yes.
start breathing normally?
She's-
She does
Yes.
not return to spontaneous breathing on the first attempt at head tilt chin lift. What do we do next?
Do it again.
Yeah,
Again.
one more time. Yep.
Right.
One more time.
So you do it again, head tilt chin lift. She begins gasping and breathing.
Immediate.
Immediate. Immediate.
Scrum perfusion is 2 seconds.
Immediate.
She regains consciousness and can answer questions and perform simple tasks. There's no visible signs of bleeding. What do you triage her as?
Immediate.
I guess I would say delayed.
Immediate.
Okay.
Delayed.
Immediate.
I would
Wait, who
put-
said delayed?
I think delayed.
Why delayed?
I would put something under her shoulders to keep her chin lift.
Yeah,
Or
She's
have
conscious.
somebody lift it.
she's conscious. You have
Conscious and can follow simple directions.
She should be breathing. Maybe she had a couple breathing, and once we got it started, it seemed like she was doing okay.
Okay. So this is a tough one now. The answer is immediate because she was not breathing to begin with. That is
And she could.
the full stop. Even though she's breathing now, she's acting normally. Her skin perfusion is normal. There's no signs of severe bleeding. And she's conscious and can answer simple questions and perform simple tasks. Because she was not breathing to begin with, she is immediate. Something caused her to stop breathing. We don't know what. It could be something neurological and she could just stop breathing again after we walk away from her.
Right.
We just don't know. Now, do you need to put something under the back of her shoulder blades to keep her
Yes.
airway open?
Yes.
I would probably say have her lay back, go ahead and put something under her shoulders because again, you don't know why she was unconscious and stopped breathing to begin with. So if it's something she has a seizure or narcolepsy or whatever, you don't want that to happen again. So just, tell her to lay back, put something underneath her shoulder blades to keep her airway open. If she passes out again, then at least her tongue is not gonna occlude her airway.
Patrick, what do you think of taking one of your better walking wounded and asking them to sit with this victim and keep an eye on her, see if anything changes?
It depends. Do you have 15 more victims ahead of you?
Then you
And you
wouldn't.
only have one more walking wounded? It really depends on what resources you have. This person seems to be okay right now. I would say if you can put something, a backpack or a shoe or something, a rolled up sweater underneath her shoulder blade, just tell her lay back. We're going to get back to you. That might be enough, but it's a judgment call. What resources do you have and what do you still need? Because you don't want to find out, oh, I just put this person here. That's my last walking wounded, and now I need 2 more walking wounded. All right, victim number 4, male 13, breathing normally. Lethargic, responds to your question slowly. 2-second perfusion. Doesn't know where he is or what's going on and can't perform simple tasks.
Immediate.
No visible signs of bleeding.
Immediate.
Immediate.
I'm going immediate on this one. The lethargic and slowly answering questions. Doesn't know where he is.
Anybody say delayed? All right, immediate it is. That one's pretty simple. Something is going on neurologically with this person. We don't know what it is. Mark him as immediate. Pretty much, if there's any doubt, mark him as immediate. We'll get back to him. We'll reassess him later.
Patrick, got a question on that one.
Yeah.
What if it could be psychological trauma that's causing the slow response?
We don't know. And that psychological trauma may manifest somewhere else. So they failed the test on the can't perform simple tasks. That makes them immediate.
Gotcha.
Can I ask the question?
Yeah.
I mean, isn't the key what if? Because if you're asking yourself, what if, then you've just defeated everything. The object is to get in and out of there as fast as you possibly can.
Exactly. The key here is that cannot perform simple tasks.
Right. And you
Immediate
just,
fail. They're immediate. The justification is we don't know what's wrong with this person.
Right.
Something is wrong. We have to say this person's immediate and get back and reassess them
Could
later.
even be a concussion.
Could be a lot of things. We don't know.
Yeah.
We're not doctors.
matter.
As an EMT, I cannot diagnose somebody. Something is wrong with this person. I don't know what it is, but something is wrong with this person. They need immediate medical attention. Victim number 5, female, 12 years old. Not responsive, not breathing.
Immediate.
See the head tilt, chin lift. Does not respond. Does not resume spontaneous breathing. You mark him as immediate.
No, he's dead.
No.
Again.
You're just gonna let her.
No, yes.
Just mark her black
chance.
after the
Yes.
first attempt here.
No, you
Here, here, she,
Again.
so far, she's.
Two times. Try
You're gonna
twice.
try the head tilt, chin lift again.
Right.
She does not return to spontaneous breathing on the second attempt.
Now she's dead.
Yes.
Bye-bye.
But her skin perfusion returns in 2 seconds.
Oh,
But she can't answer
She still failed.
or perform simple tasks.
She failed the first one.
No
not
visible
breathing.
signs of bleeding.
Immediate.
All right. Immediate. Why?
I will say immediate.
Deceased.
Wasn't, well,
Why?
She's
why
about
for the
to
people who say
die.
immediate, why?
not breathing.
Do we check for pulse at any point?
No. Most people can't accurately check for a pulse, so it's not part of the test.
Patrick, it seems like with not breathing, there could still be some blood pressure, which is causing the 2-second perfusion.
Uh-huh.
But if she continues not to breathe, that's not going to be good.
Correct.
After a while, I mean, I don't know, with a minute or two, no breathing, they're going to be deceased.
Yes, exactly. This is one of the hard ones. You have a 12-year-old girl who you can't get her to breathe, but she still appears to be alive. She's got blood flow. She's got skin perfusion. If you were to check and she has a heartbeat and she has a pulse, what is she? Immediate? Delayed? Deceased?
Immediate.
Immediate.
She's deceased because you would not have gone that far after you did the second head tilt chin lift.
Exactly. If you can't get her to breathe, she is going to die. There's nothing you can do. We don't know why her airway is blocked, but she's not breathing. We don't know if she has brain trauma or something causing her to not breathe. There is literally nothing you can do with our skill set to make this person not be dead. And that's going to be the difficult part. When you come across someone who is not right now obviously dead, and especially if it's a child, that's going to be where you want to mark this person as immediate. You want to work on this person and try and bring them back, but you're doing a disservice to everybody who has not been assessed yet.
Well, I'm looking at it. It says she's 12 years old. Couldn't you account that maybe she has a piece of candy or gum in her mouth and some marking them as immediate? Somebody who knows CPR or something can check in there and remove the blockage, and she's good to go. No,
That is an argument that will get you in trouble.
Yeah.
That is why this slide is here, to make you want to say I want to do something to make this person live.
No, I'm just marking them as immediate so that somebody in triage over there who has the skill set may be able to look at. And then they can recategorize them as they're done.
No, if you're following the triage protocol, you do the head tilt chin lift twice. If they don't respond, you mark them dead and you keep going. You don't even go as far as checking anything else.
And remember, the EMT was 15 minutes away, so they're not going to last 15 minutes without breathing.
Yeah.
Exactly.
So you're
This is why this is a difficult slide. This is why, again, this one's in here. This is designed to trip you up. It is designed to make you think, but what if, what if, what if? The answer is 32 can do. Not breathing. You try and open their airway twice. They're still not breathing. You mark them as dead and move on. And that is going to be one of the hardest things, if you ever encounter this, that you will have to do. Victim number 6. Female, 13-year-old. Breathing rapidly. Alert and coherent, but complains of sharp leg in her pain. Sharp pain in her leg. For second perfusion. She can answer questions, perform simple tasks. She's got a large gash in her leg, and blood begins to spurt upon examination.
Immediate.
Immediate.
Okay.
Immediate.
So you tag her red and move on?
Yeah. No, I try.
Stop the bleed.
How about some pressure on that blood?
Get it. Not
bleeding.
assist with
If
pressure.
it's spurting, it's an artery.
Exactly. That
Raise the
spurting blood
leg.
will kill her very quickly.
Yep.
So yes, she's immediate. That is absolutely true. But she's got some problems that you might be able to do something about right now. Apply direct pressure. Have someone else apply direct pressure. Have her attempt direct pressure. She's probably too far gone at this point, that 4-second perfusion. She's not going to be able to stop her own bleeding at this point. But this is where you're probably going to put when you're walking wounded and say, apply as much, put your knee right here above where this thing is bleeding and just lean into it. Try and stop this blood loss from killing her. And don't move. Just stay there. Hopefully, when you get back to her, she's still conscious and that you managed to stop the blood long enough, or the blood loss long enough to get a tourniquet on that injury and get her that immediate medical attention she needs. Because that 4-second perfusion means she's lost a lot of blood. And if she loses any more, she's dead. Number 7. Female, 12-year-old. Breathing very slowly. Lethargic, but responding to your questions just slowly. 2-second perfusion. She can answer questions, perform simple tasks, but everything is just slow. No visible signs of bleeding. What do you triage her as?
Delayed.
He's a little off.
Delayed.
Immediate.
Delayed, why?
She passed all the
Because
tests.
she can do everything.
Delayed.
30
Normal breathing, normal
can do.
perfusion.
She passed
Immediate.
32 can do.
Immediate, why?
Because she's probably going into shock.
And we don't know why she's breathing slowly.
Well, you just assume
that's
she's
my
going into
key.
shock.
It seems like her mental is a little bit delayed also, so she's got a couple of strikes against her. I'd go immediate.
Yeah. The breathing, you don't know why she's breathing slowly or answering questions slowly. So I would say immediate.
This is one of the challenging ones because she's borderline. This one I would say is going to, when in doubt, mark her as immediate. This might be her normal. This could very well be she is normally breathing very slow. Maybe she's an athlete, but maybe she's also has some developmental disorder, and that's why it takes her longer to answer questions. We just don't know. But she passed all the tests. Again, that 32 can do actually has no bottom floor. If the person breathes once every 30 seconds, that passes the test. But because we just don't know, because there's a question here, because she's passed every test, but something does not feel right, I would mark her as immediate. Let someone else retriage her. Worst case scenario, there is something wrong with her. We marked her as delayed, and now she's waiting for medical attention and slips into a coma because there's something wrong. Then we missed it. So I would say on this one, immediate. But this is one of those challenging ones. This is why this is in here. It makes sense to everybody?
Absolutely.
Yep.
Yes.
All right, victim number 8, male, 17, gasping 4 times a minute, eyes wide, can't talk, skin ashen, 5 seconds skin perfusion.
Immediate.
What's an
Answer
immediate?
questions, but can perform simple tasks.
Doesn't matter.
He's in shock.
No signs of bleeding, but severe bruising on the neck.
Immediate.
Veil perfusion.
Very,
Seems like immediate.
he's immediate in the first one, gasping.
Immediate.
And that bruise on the
Alright.
neck, who knows what that?
This one is
And the skin is ashen. That's a shock sign.
Absolutely.
this one is circling the drain. Gasping 4 times a minute. That when somebody's gasping, especially on a slow rate like that, it's not really breathing. Actually, it's called oh wow, agonal breathing. So this person is, I would mark them red, but chances are this person is going to be blocked by the time they are reassessed.
Yeah. Exactly.
It's bruising on the neck if it's behind the ear.
Something is wrong with this person to the point where they've gone into shock and their body is starting to, it's failing to compensate. So immediate, but just be aware this person is in really, really bad shape.
That's an expectant, right?
I would expect them, but I would still mark them as immediate. But hopefully they're still alive by the time they get reassessed. We just don't know. All right, victim number 9, female, 17. Breathing normally, alert and coherent, complains about pain in her abdomen every 10 seconds.
10 minutes.
Sorry, every 10 minutes. 2-second perfusion. She can answer questions and perform simple tasks.
Delayed.
10
months pregnant.
Ooh.
Still delayed.
Delayed.
Clear liquid on the
she
seat
is
and floor
immediate.
beneath her
She's
leg.
gonna have a
She's
baby.
in labor. She's in labor, immediate.
He's still delayed.
Idiot.
Still delayed.
Delayed.
Ask a woman, she's still delayed.
Okay.
She's immediate because it's got clear liquid.
She's feeling the pain every 10 minutes. The
And
baby's
that's
got
long-
to
taken care
How
of.
long does a woman's first
Women
child
have been
usually take
delivering babies
to
on
give
their
birth
own
to?
for a long time.
Please don't talk over the
every 10
instructor.
minutes. The baby's coming. That's when they tell you to go to the hospital.
But for first-time mothers, how long does it usually take
Oh.
before you actually give birth?
A long time.
A long time.
36
Not
hours.
me.
Yeah.
Mine came real fast, both of us.
Forever.
My
So-
baby mama was like 36 hours in labor.
Yeah.
And then they finally
So
did.
delayed or immediate for this person?
Delayed.
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 Just because she's in active labor does not mean that she's immediate. She's passed all of the tests. So yes, delayed, but keep an eye on her.
Women have been doing it forever.
Yeah, and
Keep
she
an
can
eye on her
always
just
be
because
moved up.
she may go south on you because we don't know why she's in labor.
Right.
There might be trauma associated. It might be trauma-induced labor. She was
She's
just in
9
a
months
in a bus
pregnant.
wreck.
That's why she's in labor.
Yeah. Oh.
And she's gonna be freaking out, yes.
Victim number 10, 50, male, breathing rapidly. Alert and coherent, complains about sharp pain in his leg. Said it right this time.
Immediate.
5-second perfusion.
Immediate.
Sounds like immediate.
Fusion.
Can answer questions and perform simple tasks. Legs are pinned underneath the steering wheel. What do you triage him as?
Immediate.
Immediate.
5-second perfusion makes it immediate.
Exactly.
Absolutely.
Rapid.
Rapid breathing makes it immediate.
Yeah, rapid breathing makes him immediate.
Rapid breathing
And
too.
if his legs
Yeah.
are pinned, that means his circulation, he might not be getting blood.
We don't know. There's a lot of things going on here. This is the bus driver.
Yeah.
His legs are trapped underneath the steering wheel, meaning that the seat's probably been pushed up, or the engine compartment's been pushed back into the driver's area. So the legs are pinned. Also, that steering wheel could have impacted his chest, and you don't know what kind of damage this person has internally.
And you'd probably want to let your team leader know that they're going to need to call for extraction. I mean, this is serious.
Yeah.
That's a very good point. Can you remove this person, get them out to be transported?
No.
We don't. Fire
Exactly.
department does.
This is a problem. If
Yeah.
the fire department's not coming for this victim, there's not much you can do.
No.
Anything you do might actually make this person worse.
Mm-hmm.
This is a hard one. And we really need to get over the mentality that CERT teams tend to have, which is fire department's coming. We call for them, they're going to be here. And you have to accept the fact that there are some things that you will not be able to do in a disaster. There are some victims that might be salvageable if the fire department shows up that you are not qualified, you are not skilled, you are not trained to handle. This might be one of them. This person may die in this bus.